Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. If you are just joining us, we are talking about constipation. Dr. Jitka Lom is here giving us some advice on how to avoid it and how to deal with it before it becomes a serious problem. Let's get now to some of our viewer questions. Carl from Hagåtña asks, can the medications I take be the cause of my chronic constipation?
They sure can. That's a great question. A common one is taking Tums, for heartburn. And another one would be Motrin or Aleve. Also some blood pressure medicines. An example would be something called Norvasc. Antidepressants are a common cause. Those would be the top ones I can think of. Yes, definitely. Check it out with your doctor or even online.
So if somebody's taking medication because they obviously need to for, some of the things you just said, then they just need to increase the amount of fiber? Or?
Yes, or if it's really disabling or not manageable, then usually a medicine can be switched to one that doesn't have the same side effect.
Okay, Lori from Dededo asks, is it true that eating too much dairy can be the cause of my bowel problems?
Yes, it may. Some people who drink milk become quite constipated. Others, it helps them go, but in general, it can slow things down a bit because of the calcium that you have in it.
Okay, Jessica from Manila asks, why do pregnant women get constipated? What can I do to remedy it?
Almost all women will get constipated in pregnancy for a couple of reasons. First of all, they're taking prenatal vitamins that have iron in them, another great reason for being constipated. Then the hormone progesterone increases when we're pregnant, and that one makes our bowels more sluggish. And another thing is that they tend to become a little bit less mobile. The tummy's large and pressing on the guts, and so it's hard for the intestines to squeeze as easily. So how to prevent it? Try to stay active, drink lots and lots and lots of water, and prune juice would be really helpful.
All right. You keep mentioning those prunes. Doug from Sinahanya asks, can chronic constipation be a sign of colon problems? Can a colon cleanse help?
Yes, it can. In children especially, constipation that isn't related to their diet can be due to something called celiac disease, when they're not processing gluten or wheat very well, and that's not an uncommon reason. And then as far as the colon cleanse, or I guess another reason would be if you have a slight intestinal blockage, that would be another reason why you keep getting problems. And a colon cleanse is a great idea. You can either pick up something called magnesium citrate, which is a little green bottle in the pharmacy, and drink that down, and it'll pretty much clean everything out. Or you can ask your doctor for a prescription.
Okay. Now Patrick from Telefofo asks, how does exercise help my bowels? And you kind of touched on this earlier.
Yeah, so when you exercise, you mobilize the blood from your middle section into your muscles and so on. And so that takes toxins away from your intestines and circulates them out and helps the guts move more easily. You'll be amazed at how beneficial that is. Just a 30-minute walk every day.
Okay, Judy from Jotnya asks, I travel a lot and find myself constipated after my plane rides. Is there a link?
There sure is. For one thing, you're not moving. You're sitting immobile for about 8 hours or longer. For another thing, as you go up in the airplane, the gas in your intestines expands, and so things aren't really being squeezed along as well as they normally would be. And then another thing is you tend to get dehydrated, especially if you're drinking any alcohol on the flight, which is usually a bad idea. So just remember to drink more and more and more liquids during the flight, and also don't be afraid to use the restroom, which is another reason why people will tend to get constipated, because they'll be too shy to use the restroom.
Okay, well that's it for our viewer questions, but I did want to throw in from earlier, how do you know if it's something more serious? When should you go see a doctor? If, maybe you've gone a week and you've had a couple and
not sure.
How do you know?
Yeah, it's true. How do you know? I think if you've tried the simple things, you've drank lots of water, you've tried maybe occasionally, very occasionally, some sort of laxative, you've tried the fiber, and you're still not going regularly and you're concerned, you can have an x-ray done that will actually show you how much stool you have in there. It's really very simple, and your doctor can feel your tummy and see if they can feel any stool in there, and they can give you other suggestions. Rarely we have to use medication to help move you along, but remember, if you've been constipated for many months to years, it's going to take a while to get that reversed. So just be very patient, give yourself a month or two of better habits, and also take the time to use the restroom, especially in the morning after your breakfast. Take the time. People are so rushed they don't even have time to use the restroom. And remember to teach your children also to use the restroom and of course wash their hands after.
Okay, so any last parting words of advice? Drink the prune juice. Doc really suggests that. Exercise every day, drink lots of water, and eat fiber-rich food, vegetables and fruits. Is that about it?
That's about it, yeah. And just be aware that this is a normal thing that we all have to take care of.
All right, Doc, thanks so much. And I appreciate that you're just so able to